This is Dr. Sellers Educate, and today we're focusing on Competency 4, Participate in Curriculum, Design, and Evaluation of Program Outcomes. These are our course objectives. Let's jump in with a reflection on Competency 1. We will be using Dr. Linda Caputi's CNE review book as our guide for our time together. Facilitation of learning. We want to make sure we take a look at educational theories. They're in Appendix A of the review book. We should take a learner-centered approach. Ensure that you know what that means. When we look at our teaching strategies, we should consider the content, the setting, our learner needs and styles, the desired learning outcomes, as well as our method of delivery. First practice test question, if you'll pause the video. The answer is A. We want to use Socratic questioning to help students determine what to assess. Competency 2. We facilitate learner development and socialization in many ways. One of the ways that we've talked about is through advisement. There are different levels and types of advisement: prescriptive, developmental, and proactive or intrusive. Make sure you understand the differences between Bloom's taxonomy, 3 domains of learning. Competency 3. We want to evaluate and assess our admissions, progression, and graduation policies, ensuring that the details are clearly outlined in our student handbook and the expectations are known regarding these specific processes. Measurements, norm versus criterion referencing. The assessment interaction, make sure you understand figure 3.1, as well as exam analysis to include reliability and validity. Demonstration of knowledge of curriculum development includes active participation in the curriculum design. There should be 6 to 9 SLOs. Sources to support our SLOs include NLN, CUSIN, AACN Essentials, and the NCLEX test plan. There are 6 elements to consider when we think about curriculum development. So how do we figure out what to teach? We know that there's no way we can teach everything. So how do we prioritize that? Well, there are new models for teaching clinical judgment. It's divided into 3 layers. There are 3 areas that need to be considered: strong emphasis care. Educators should actively participate in the curriculum design as we seek to ensure our students are receiving a well-rounded education and are practice ready for the nursing career that they are transitioning into. There are 3 different curriculum models: the traditional body systems, the concept-based, and then the content-based. As we look at our program evaluations, we want to review those. We want to make changes that are continuous to improve the overall quality of the nursing program. There should be curricular revisions along the way based on our program assessment plan, as well as collaboration with our clinical partners and any other data that we gather along the way to help guide and improve our program. Next steps, Competency 5. I'm happy to answer any questions that you have. I am Dr. Sellers Educate.